Hello, I'm Dr. Audrey Klenke with Pinnacle Medical Group, and today I'm talking about mommy makeovers. Mommy makeovers can be anything from breast surgery to tummy surgery. Sometimes it includes liposuction and other procedures. So really, every mommy makeover is a little bit different, and it comes down to meeting with your board-certified plastic surgeon and coming up with a personalized plan for you. So let's talk a little bit more about specifics. So breast surgery is very common for mommy makeovers, and it can be anything from a breast augmentation where you're putting in an implant that gives a little bit more volume and fullness to the upper pole of the breast. Sometimes patients don't necessarily want more volume, they just want a better shape and a better looking breast, and that sometimes is just a breast lift or a mastopexy. Some patients need both. And then I have patients who are actually unhappy with too much volume of their breast. So some patients want a breast reduction. Tummy procedures are also really common with mommy makeovers, but not everyone needs the same tummy procedure. Some folks need a traditional tummy tuck where you're strengthening the muscles again and removing skin and extra fat. Some patients actually have a belly button hernia that happened during pregnancy from the pressure, and of course we fix that at the same time. And some patients actually need even more tissue removed around their lower back or their sides. That can be an around the world tummy tuck. And then more rarely, some patients need what's called a reverse tummy tuck, where you're actually removing tissue on the top of the abdomen and your incision hides underneath the breast. Another common component of a mommy makeover involves addressing the thighs or the buttock area, and sometimes that involves removing tissue using liposuction or even non-surgical techniques that we can talk about, and sometimes it involves adding volume. So if we're removing fat from one area, sometimes I can add it to other areas like the buttock or the breasts. Occasionally, I have moms who are unhappy with the way their arms look after all of these body changes, and they don't like wearing tank tops or being out in the summer because it's embarrassing. Some people have extra skin that needs to be removed surgically. Some people just have a little extra volume and they can get away with liposuction or some of our non-surgical techniques. As a surgeon, I love to do surgery, but not every patient needs surgery at every body location. So some of my patients will combine non-surgical procedures with surgical procedures to achieve their goals. In my practice, I use what's called ultra-shape power, and it's a non-surgical way to permanently destroy those stubborn fat areas with no downtime and no pain. I also use a device called Exilus, and that's a radio frequency device that helps tighten skin in certain areas. So again, not everybody needs surgery everywhere, and that's really comes down to a consultation with your board-certified plastic surgeon to find out what's right for you. Plastic surgery is constantly evolving, and so there are constantly new things out there that are better and improve patient experience. One of those things that I see a lot and that I use in my mommy makeovers is what's called breast auto augmentation. Some patients really don't mind the current volume of their breast, they just want the breast to look different. But rather than the old school traditional mastopexy where you're mostly removing skin, a breast auto augmentation involves rearranging the actual tissue within your breast, so it sort of resembles an implant without an implant. I'd say the other really cool things are some of these non-surgical techniques that a lot of patients really don't have the downtime or want to minimize their downtime after surgery, and from my professional opinion, don't necessarily need surgery to achieve their specific goals. So those patients can kind of mix and match surgery and non-surgery, and we didn't really have those before. I've mentioned a lot of different procedures. Not every patient needs every procedure. It really comes down to what you need to help achieve your goals, and that's a conversation between you and your board-certified plastic surgeon. I often tell patients it's sort of like a restaurant menu. There's lots of things on the menu, but you don't necessarily need or want everything. The ideal candidate for these procedures are someone who is ideally done having children, because your body will change again if you do get pregnant again. So while this whole episode is about mommy makeovers, you don't necessarily have to be a mommy to come in and do these fun things. In fact, we have a lot of daddies, so maybe we should have a daddy makeover. It's really for anyone who has gone through some body changes and now you're currently at a stable weight, stable lifestyle, and you're unhappy with the way your body looks. A lot of our patients ask about downtime, which is really important to busy moms these days. You're usually taking care of little ones, and some of our moms are working, and life is crazy. So for most of my patients, for those who are working, you're sometimes taking a week or maybe 2 off of work, depending on what you do for work. I also recommend that moms who have young kids at home start planning their help. So you're not going to be able to do everything that you would normally do right after surgery. That might mean a family member coming to stay with you. It might mean your spouse staying home from work. And then most patients will also want to get back to the activities that they were doing before in terms of exercise, not just daily life stuff. That can be closer to 4 to 6 weeks. And really your body forms full strength scar at 8 weeks. So inside and outside, it's almost impossible to damage your surgery after that 8-week time frame. Most of my patients and I have very honest conversations based on how they're currently living, things that they normally like to do, whether they're swimming or doing CrossFit. So we can kind of come up with a realistic plan for how long it will be before you get back to those things. And then of course, we're meeting a lot after surgery. So I'm able to update things depending on how you're healing. So everyone kind of knows and it's not a surprise. Scarring is a necessary part of surgery. It's how your body naturally heals so that your skin can regain strength. And a lot of our patients want to try to minimize how those scars look so that over the long term, they look as good as they can and they can hide them. So the most important thing is for me as a surgeon to try to place them in areas that aren't going to be seen very frequently. And then I counsel patients very closely about how to treat their scars afterwards. So the first couple months, your scars are going to be pink and a little bit thick because your body is naturally recruiting blood vessels there so that your scars can mature properly. After that 8-week time period, again, your scars on the inside and outside are as strong as they're ever going to be, but they continue maturing. That means they continue to flatten and soften, and the colors continue to fade over time, upwards of a year. So there's a little time window there. The first 3 to 6 months are critical in terms of what you can do as a patient. Scars love pressure. They love to be massaged. So some of your compression garments after surgery will help with your scars. Scars do not like sun, so we want to avoid baking in the sun at the beach or exposing them to direct sunlight, so sunscreen is your best friend. And then topical silicone products. No one really knows exactly how they work. It was discovered through actually burn patients that topical silicone is fantastic for scars. So there's a couple products that I like in particular, and my patients use them and do very well. Some patients genetically don't form great scars, and usually they've had a procedure already, or they have a family member who's had thicker scarring or ropey scarring. Those patients I have to keep a very close eye on because we do have options for them too. A lot of times it's a steroid treatment that will help to keep your scars flat and happy. Another question I get is, how long will this last? Is this a lifetime thing? Do I have to do this again? And similar to many of the other procedures I perform, I warn patients that while I'm pretty good with a scalpel, it's not a magic wand, so I can't lock you into time. Time keeps ticking. Some of our patients do really well long-term because they maintain that active lifestyle and eating well, so things don't drastically change over time. Some of our patients have other life things that happen. Some of our patients unknowingly get pregnant again. That will definitely create some changes that we may have to address again surgically down the road. Especially for my breast patients, I usually see them back at least annually. And some of that is so that I can do an exam and make sure everything is still looking great, feeling great, people are happy. And it's also to give people updates. If there's any new information about an implant that I want to share with you, that's the best way to do it. It's important for my patients to know that every surgery has risk. So does driving down the road in your car. The important thing is that you know what those risks are and how to try to minimize them. So my patients have explicit instructions, not only after surgery, but before surgery. There are things that I do that are very easy that help reduce your infection risk. Of course, there are things within the operating room that are very important to try to reduce the risk as well. But then afterwards, patients need to know a lot of times what their activity level can be and how often and how long do they wear their compression garments, and all of these things are critical. Of course, there are patients who have underlying medical problems, and sometimes those medical problems preclude you from having surgery at all. But my job as a surgeon is first and foremost to keep you safe, and then to try to achieve your goals. There are actual health benefits to having these types of surgeries as well. First and foremost, and probably the most obvious, is that people feel better about themselves. When you feel better about yourself, of course, the world is just a happier place. We have depression levels that go down, anxiety levels that go down. They've actually shown in studies that your cortisol levels, which is one of your stress hormones, goes down. So in general, that speaks volumes about how people behave around their other friends and their family, and it just generally makes you a happier person. And then of course, from a structural standpoint, I have patients who have had their abdominal wall so stretched out by babies that they can't do some of the things they want to do, or some people do have a true hernia and it's uncomfortable. So surgery for those people is life-changing in the sense that now they can do more things that they enjoy doing without pain or discomfort. They can get back to the gym and do crunches, and it just generally feels more secure. So cost is one of those things that every surgeon hates to talk about, because for us, our job is to tell you what we really think you need based on what your goals are. So the first step to figuring out what kind of an investment this is going to be for you is to come in and have a consultation with a board-certified plastic surgeon. It's also hard to give people estimates in terms of cost because every patient is so different and every patient needs and wants different things. So really, I recommend that you go online to plasticsurgery.org, type in your zip code to find yourself a board-certified plastic surgeon or 2 or 3, and go and meet with them and see who you connect the best with. And at that point, they will give you a detailed menu. As a mom of 2 small children and currently pregnant with my 3rd, I definitely understand the frustrations and all the changes that can happen with having children. And of course, they're wonderful blessings in your life, but you as a mom and you as a person also deserve to feel happy long-term and to feel confident in your body. So I love working with these types of patients because I really understand and I really feel like we connect. It also gives me hope personally that at the other end of my journey, there's someone who can help me too. So we really look forward to meeting you. And if you have any additional questions, you can look for us at pinnaclemd.com, or you can check us out on Facebook and Instagram. Our goal here at Pinnacle Medical Group is to provide a premier resource for our local community to optimize skin and global health.